So today we are going to start a series of videos on recurrent pregnancy loss. So these will not be videos covering pregnancy loss itself as a single entity, but those who suffer recurrent or repeated pregnancy losses. This is a topic that is very complex and also very important. It causes significant health impacts on parents or intending parents, and often because it's so complicated and for other reasons, it gets sort of swept under the rug and not talked about. And I think it is a topic we do need to talk about. Through these series of videos, we'll try and look at different causes and what we can do about it in terms of management. Sometimes these causes are very non-controversial. These are very straightforward and everyone agrees on them. Other causes like autoimmune disorders and thrombophilias or clotting disorders are much more controversial, and the management or the treatment is much less clear. When we look at pregnancy loss itself, a single pregnancy loss is extremely common. As human beings, we're not very good at creating embryos that are designed to stay and then have a high chance of turning into a baby. This is mainly sort of at the genetic level, that the integrity of our genes as they reproduce are not as good as other animals in terms of preserving that structural integrity and making sure there are minimal genetic mistakes. As a result, pregnancy loss, certainly in the first trimester as a single loss, is extremely common. The numbers quoted around 20-25%. The true figures probably seeing around really at about a third of pregnancies are lost in the first 3 months. So really, really common. When we're starting to look at recurrent losses, and this definition has changed in the last couple of years. It used to be 3 losses or 3 consecutive losses. Now it's just 2 losses and they don't need to be consecutive. So if we take the current definition of 2 losses, that defines a recurrent pregnancy loss, we think that covers around 5% of couples who are trying to conceive and start a family. Within recurrent pregnancy loss itself, there's always been an argument to say, is it an issue with the embryo itself, or is it an issue with the environment in which the embryo is trying to implant, or is it something else? Is there a medical condition? Is it the male? Generally, we would say that as a general rule, this is very, very generalized, that if people are suffering between 1 to 3 losses, it is much more likely that the reason is probably embryonic in origin, especially if these losses occur really early on. And as I said, that's really because us human beings are not very good at maintaining the DNA integrity when we create new individuals. However, once you get beyond sort of 5-6 losses, and then that sounds terrible, but there are certainly couples who come to me with 6-7 losses, that the reasons move beyond the embryo and it's something else got to do with the body, whether it's an autoimmune disorder or whether it's another condition. When you look at population studies, and these studies have come out of Europe, if we were to do nothing, and that sounds very, very cruel, but there are studies that look at this, that if we were to do no intervention and just watched couples try and conceive and then tell them to keep trying if they're lost to pregnancy, the chances of them conceiving and eventually taking home a baby are quite good. So if you look at the Dutch studies, in young couples suffering 1 to 2 losses, their chances of eventually taking home a baby at some point is probably around 60 to 70%. Now, that rate of take-home baby does drop with the number of miscarriages or pregnancy losses that occur, and also it drops with the age of the mother. So in these coming videos, we're going to try and look at some of the causes or the known causes of recurrent pregnancy loss and what we can do about them. So the known causes will cover genetic causes, mainly looking at chromosomal structural rearrangements. We'll look at anatomical distortions in the Mullerian duct or the female reproductive tract. Again, this is a controversial area where some studies show that these abnormalities do play a role and others don't. We will also look at things like hormonal changes and hormonal imbalances, Infection and inflammation is very topical, and I think especially in the realm of inflammation of the uterus lining, that's probably an often overlooked and potentially reversible cause of pregnancy loss. Obviously, the hot topics of autoimmune disorders, where potentially we think that the immune system may not recognize the embryo as its own and therefore reject the embryo, clotting disorders or thrombophilias, and we also would look at male causes as well, and in exposure to environmental toxins. So most studied in this area are obviously smoking and alcohol, but there are other sort of forever chemicals, what we call endocrine disruptors, like the plastics and the BPAs, that have also been looked at. And finally, we acknowledge that about 50 to 70% of recurrent pregnancy losses are unknown. So we never find a cause of that, and that can be incredibly frustrating for the couples not knowing a reason why this keeps happening to them. So hopefully in the videos to come, we'll look at each of these topics.